Welcome, everybody, to the second in our series of webinars on AI in healthcare. I'm Anthony Brown, the CEO of Health Consumers New South Wales, and I'd like to welcome everybody to this webinar this afternoon. Before we start, I would like to acknowledge the traditional owners of the many Aboriginal and Torres Strait Islander lands that everybody's joining us from this afternoon. I'm in the Health Consumers New South Wales office on Gadigal land and pay my respects to elders past, present and emerging, and extend that welcome and respect to all Aboriginal and Torres Strait Islander people who are joining us today. I'd also like to recognise the importance of lived and living experience, the experience that people bring of health and illness, of receiving treatment, recovery, and people's experience as carers and family members is so important. That experience and the voices of people with this lived and living experience are vital and powerful and absolutely needed to make healthcare better. And we acknowledge and thank everybody who, through their work as a consumer representatives, shares their experience to make healthcare and research better. Before I introduce our speakers, I'd just like to go through some quick housekeeping tips about how we're going to be running today's webinar. This webinar is being recorded and the recording will be made available to people after the session. Please note that as part of our privacy policies, we request that you please don't use AI tools or use an AI tool to record the meeting by default. If you have an AI tool running, we ask that you please disable it for the duration of this webinar. We will be using the question and answer function for this webinar, which Tara will make available now. We ask that people please type in questions as we go along. As our panelists are speaking, we will use these questions. Will come back to during the discussion time at the end of the webinar. And we ask people to please monitor the questions as they're being put in. And if you like a question, please vote on it. And the questions that have the most votes will be what we'll put to our panelists first. We're very aware that people have put in a number of questions before the webinar. I want to thank everybody who's done that. We've received so many questions, we're not going to be able to get to them all in one webinar. But as I've said before, this is a series of webinars on AI in healthcare and research. And over the course of this whole series, we hope that we'll answer those questions. And at the end of this webinar, we'll let you know about what's coming up for our future webinars. So why can't I move the slide on? Here we go. As we will. If people want to go back to our previous webinar where we talked about artificial intelligence in healthcare and what consumer representatives can do to be more efficient in their role, that webinar is available, and we invite people to go back and look at it and look at some of the tools that we've made available there. So we'd just like to start off by taking a quick poll and getting an understanding about where participants are at with involvement in research projects that use AI. So I'll invite Tara to please put that poll up. And please, if you could just give us a quick indication about your involvement in these sort of projects.
Just the first question.
Right. All right, so we've got about 20% of people who have been involved in projects and about 60% who haven't, and 20 who aren't sure. And that's fine because one of the things that we'll see as we go through today is that AI is being used in a number of ways that we aren't always aware of. So that's really, really helpful. So thanks everybody. That's a really good indication about where we're at. So I think we can end that poll now. Thank you. And I'll just introduce our first speaker. So Diana Trickett is known to many people who's on the call today. Diana's a member of Health Consumers New South Wales Leaders Task Force and is also a member of the Sydney Health Partners Consumer Advisory Panel since 2022. And I should have said at the start, apologies to our friends at Sydney Health Partners, that this webinar is a joint presentation between Health Consumers New South Wales and Sydney Health Partners. Diana's been a very active consumer representative across a number of research projects, including Sydney Health Partners Geriatric Medicine's Clinical Academic Group and the Faculty of Medicine and Health Consumer Advisory Group. And we can see some of Diana's many involvements in consumer activity across both health care and medical research there. What I'd like to do now is I'll just stop sharing that and welcome Diana and invite Diana to give us an introduction to why this discussion about consumers and AI is so important. So thank you, Diana, and over to you.
Thank you very much, Anthony, and good afternoon, everybody. It's good to know we've got so many consumers and others, and I'm not sure online, and we've got great hopes for this series of webinars. Okay, we'll go on to the next one. Thanks, Tara. This might come as a shock to anybody, but we know that consumers know that AI and healthcare is transforming our workplaces and our involvements in various projects. It's all sorts of stuff that some of which we may not even be aware of. But there's corollary to all of that is that this involvement and this development, this rapid development, is raising urgent questions about regulation, governance, cybersecurity, and patient and consumer trust. And as a member of the contributing editors to healthcarebrew.com, has phrased it as like a lion that we can't outrun. And it probably feels like that for a lot of us who are involved in research projects or have great concerns about how our loved ones or people are being managed in the healthcare system. Next slide, thanks. So in order to just set the scene, because David is going to provide a lot of the tips and strategies and things that will be very welcome to all of us. In the last 6 months, even since the first webinar with Wollongong University, there's been a number of symposias, online network outputs, citizens' juries, that was the Wollongong one, World Cafe reports and in meetings, and there's 4 key themes that keep coming through that I'm aware of, and they are security and safety of our data, what's the validity and reliability of data, this is across the board, in healthcare settings and in research, the ethical uses of AI in research and medical interventions. How do we know that there's a standard being applied to some of these methods that are being used in research? Governance and regulation of AI and the accountability. Who's responsible? Who monitors? Who corrects? And fourthly, the need for consumer education and training so that we get some sort of overarching response and development of AI literacy amongst consumers. Next, thank you. So from my perspective and from Sydney Health Partners and our consumer advisory panel has had a lot of conversations about this. We were fortunate enough to have David present to our December meeting last year. So it seems that the technology is moving far faster than governance and regulatory policies and processes. So I guess the point of today is how can consumers keep pace and potentially stay ahead. I'm not sure anyone's ever going to stay ahead, but maybe stay in the mix. So next steps will be something that we can talk about afterwards. I'm looking forward to seeing some of your questions. And I'll hand back to you, Anthony.
Thank you so much, Diana. And I just wanted to let people know we'll be including links to the research projects and the other projects that Diana mentioned if people want to look up the Citizen Jury and those other works that have been happening. So thanks very much, Diana, for helping us set the scene about why this is important. And I'd now like to welcome Dr. David Navarro to give us his perspective about some tools and ideas that we as consumer representatives can use in our own work when we're involved in projects where there's going to be a use of AI. So David is a research fellow at the Centre for Health Informatics at the Australian Institute of Health Innovation at Macquarie University. And a lot of his current work has focused on novel approaches to health automation and healthcare delivery using generative AI. So things like ChatGPT and large language models. So he is a trained and experienced general practitioner and has been working in clinical practice in both Spain and the UK. And has also previously worked on providing living guidelines for COVID-19 and new evidence synthesis methods for Cochrane Australia at Monash University. We're very lucky to have David with us today. I was fortunate enough to hear a presentation David gave to the Sydney Health Partners Group late last year. And I think his insights and help in framing how consumer health representatives can help make a difference in projects with AI I found really useful, which is why we've invited David here today. So over to you, David. Thank you for joining us today and welcome.
Thank you, Anthony, and thank you, Diana, for setting the stage for this. I'm very happy to be here and presenting this to you because I think it's really important, and we researchers really need your input as we work on AI and assisted projects. Let's see if I can share my screen here. Yeah. All right. What I want to present you today is more than anything as small ideas and a small guidance of sorts on what consumers can ask when you hear or when you are invited to provide feedback or participate in a project that is about AI in health. And I think we can talk a lot about AI, and it's an never-ending topic and advancing very fast. So I won't go a lot into details on what is AI or what are the developments going on. But I would just do a few words introduction because I think it's important to more or less be all in the same page. So what is AI? It's you can hear it everywhere now. AI is in any sorts of things, any sorts of products, from healthcare to fridges to all sorts of things. What we can define broadly AI as computers doing tasks that usually or it used to need human intelligence to be completed. And that's a very broad definition of AI. It can come to more specific things, but how AI does this? What is different AI from what it used to be a regular computer program or any other sort of tool? The main idea or the main implicit idea with this is that AI or these AI programs or softwares or models is that they learn patterns from vast amounts of data. They use these patterns then to make predictions, and it can be all sorts of predictions, from what is the color of the thing appearing in the screen, all the way to a long paragraph of text. Generate content and therefore also assist with decisions. And this can be all sorts of clinical decisions, from classifying a picture or a medical image into it has disease or it doesn't have a disease, all the way to provide summaries, provide differential diagnosis, and so on and so forth. It can show us as predictions tools, image analysis tools, or chatbots such as ChatGPT or custom specific health chatbots. So having said that, not all AI in health is the same, and I think that's something that is confusing. It's confusing not only for consumers, it's confusing for the media, it's confusing for researchers as well, and is that we are calling AI a lot of different things. AI can be something as simple as a rule or an algorithm, and these algorithms can also become fairly complex. But an algorithm is basically, or a rule, it's something that says if you see X, then do Y. And an example of that could be a system that blocks a prescription when the dosage is too high. Is that AI or not? Well, it can be debatable, but I have certainly seen these sort of rules or algorithms being called AI. So I want to flag this. The next step is what we call statistical models, and that is all forms of math and statistics that build regression models. That it's a sort of a mathematical formula that we put risk factors, we put age, blood pressure, medical conditions, and so on, and putting all these factors in a maths model, in a statistical model. It will tell you something. It will tell you have risk X for a given condition, or given this, you would benefit from this medication. That's all statistical models. We have used them a lot in health, and to a certain degree of success, but also with a lot of caveats and a lot of limitations, I would say. Then an evolution of that is what we call machine learning models, and these are statistical models, but you put more data, you build more complex mathematics around them, and then they start to do predictions that doesn't seem to be easy to predict at a first glance. If you see people that is taller usually has more weight, right? That's a prediction that we can intuitively think it can be correlated. Machine learning models do predictions that go far beyond that. So they can see a picture, for example, and they can predict that something in that picture in a certain area can be suggestive of a disease, and this can go in very complex ways. On top of that, on top of these machine learning models, we have now what we call generative AI, and this is a variety of machine learning models, but they work in a specific way. Their task is not only making predictions in a very controlled way. This is A, this is B, this gives you a risk of X%, and so on. It does generate answers. It does generate a certain amount of text with explanations, with an interpretation of that input that you provide them, and that interpretation can be correct, can be wrong, can be what is called hallucinated, and this is the huge explosion of AI we see in the last 3 to 4 years, since ChatGPT was released. Examples of tools that have been used for that. These tools are being used to write clinical notes, discharge letter, patient information sheets, and now they are being built into more complex tasks as well. So when we see AI in healthcare, you just need to be aware that can be any of these things that I mentioned, or a combination of these things. If we have to put them in a sort of scale from more complex, more simple to more complex, the rule-based would be the simpler ones. The generative models would be the most complex. And this also has implications, because when we have a rule-based model, it can be very deterministic. It can be always that you see A, do B, and that's the end of the story for good and bad. When we have generative models, on the contrary, it's never a simple rule. It's probabilistic. You can ask things a certain way and get an answer. You can ask things on a slightly different way and get a completely different answer. So we need to bear that in mind when we evaluate them and we do research or health or provide health outputs with them. Quick examples of these, as I already mentioned, scan reading tools for medical imaging, risk scores in hospitals, so those that try to predict the risk of a given disease. We've seen also some form of administrative automation, triage, sorting referrals. Now we've seen a lot of implantation of AI scribes, those tools that automatically transcribe conversations and convert it into a patient record. And then we have what I would call emerging tools or emerging uses of AI, chatbots for health information, all sorts of tools that analyze big data, try to crunch a lot of data from a lot of hospitals into predicting outcomes, and then diagnostic supports and more autonomous health agents that perform tasks. So why consumers should care? I think these tools are very, very powerful. They can improve care, they can give earlier diagnosis, better access, decrease administrative burden, can save that. One of the things that we say or we hear a lot is that can save time for clinicians, so they can focus more on the patient instead of on the consumer, instead of focusing on filling forms on a computer. As Diana has said, although these tools need scrutiny, it needs privacy, fairness, safety is very important. It's a high stakes domain. We cannot let them run without checks. And more important than anything, as these tools are being built now, and it's your voice that will shape how they are built and how they are used. And that's why we need your input more than anything. So this is proposal or just a checklist or something that you can think of when asked or when there is AI involved in a project. I tried to come with a sort of a mnemotechnic rule, but I couldn't come with something. But I just realized when I was reading this today that it maps to main cities in Australia, so that can be a good reminder for this, or I might need to give it another thing. But these are a general idea of things that can be asked or are important to ask. Purpose, why this AI, what problem does it solve, data, what data, and where does it go? Bias, and will it work for people like us, or are bias considered here? Safety, how it's tested and monitored, and humans, who is responsible of this? And I will give you brief points for any of these points, for all of these points. The purpose, what problem are you solving? And I think that's the main question to ask for any AI project is why are you using AI? What is this doing? What is the problem that AI is is bringing or solving that wasn't possible before? Is this improving things for patients or carers? Do we really need AI? Is there a simple fix for this? Then all the questions related to data and privacy, what data will be used? Is this identified or de-identified? Where is this data, or who is the custodian of this data? Which organization? Does it stay here in Australia? Does it go to some server in America from ChatGPT or someone else? And are you using a secure health system, or is this a public-facing AI tool that is using ad hoc for this? B for bias, will it work for people like us? And I think that's very important question to ask. Whose data train this AI? Hospitals, regions, community? Have they include diversity of groups, age, gender, culture, language, disability? We can see also that some of these models can be trained overseas or can be trained on American data or European data, and may or may not be representative of the population here. So I think that's important to know. Have it been checked, or it will be checked, if there is this AI system is less accurate or less fair for any given group, and what the researchers will do if they find that these results are unfair or are biased in some form. Safety and humans in charge. Safety, it's very important. As I said, we are testing AIs in high stakes domains, and I don't think there is a higher stake domain than the health and the well-being of people. So we need to know if it has been tested before with real patients, or this is the first time it's tested. What do they mean, or how they measure what is good enough? It's as good as humans. Is no potential harm. What is the reasoning around the performance these models need to have, and more importantly, how they are monitored or how they are capturing errors or harms over time. Is there a process on how this will be done? And related to this and to AI in general is what is the human, what is the accountability of this AI tool? Will the AI decide completely automatically? Is there a human in the loop, clinician in the loop, that there is a checkpoint that they will decide if the AI is being used correctly or not, and will be able to override that automated decision? Who is accountable for that? What happens if it goes wrong, right? And how you will explain this to consumers, patients involved in the research, or in testing the product later on? Can they opt out, or this will be something that will be implemented as such? I think all of these questions are important. I'm not saying they are the only questions that are important, and there are many more questions, but I think these 4, 5 domains can make you think of questions. And I think more important than anything is you don't really need to fully understand how AI works. And I would say I don't understand the complexities of this very technical AI models. I understand a bit, but I think more than understanding fully what the AI works is to know what it does and what actions it takes and what are the consequences. And I think we don't need a special knowledge to answer those questions. And we as researchers, when we present this to consumers or when consumers are involved in research, we need to be able to explain this, what it does, what actions, and what are the consequences of its use. I think consumers need to feel confident to ask questions about AI using this framework, these 5 domains or any other questions that come to you or come as important. I think it's important to know where to raise concerns either as consumer representatives, systems that capture these, ethics committees, and so on. And I think it's good to bring up for discussion where might AI actually make your health experience better? What would you want to know before agreeing to be part of an AI project? I think that's important things to discuss. I was stopping my presentation here, but yesterday, preparing for this session, Diana actually mentioned something that make us think and reflect. And I think this could be another different presentation, but I think it's important also to bring this message, and is to what to ask when you don't hear we will be using AI. And what I mean by this is that more and more you are going to be participating in projects that won't be specifically about AI or AI in health, but will be using AI in some form. And that can be anything from participating in a survey, participating in an interview that gets automatically transcribed. None of these projects might be about AI, but AI can be used or will be used. And I think it's really important to ask those questions as well, because researchers could not have thought of it or might not be telling it explicitly, but there can be an AI component, and you should also know about it or should be asking questions about it. Transcriptions of interviews, automated translations, creating summaries of clinical notes or literature, tools that are embedded in other software in the hospital that might have a component of AI. So I think it's important to raise questions in any form of research if there will be an AI component. I think the questions are not that different from those that are specific for AI research, but I might be more questions even that I haven't think of yet. So ask about the data, ask about the purpose, ask about who is checking these AI outputs. And I think that would be a really good start for any research project, really. So where from here? I don't have any deep take-home messages. I think just to reiterate, I think AI is moving really fast. I think one thing to be in this space or in AI research is it keeps changing, and I wouldn't believe myself what I'm working on today 1 year ago. So I think we need to keep in mind that AI is changing a lot. What we researched 6 months ago and we say, oh, this wasn't working at all. Well, it can be that it still doesn't work, but it can also be that we have newer capabilities, and 6 months later, what wasn't possible, it actually is. I think there is also a lot of hype around AI, but it's also hype in good and in bad sense. There is headlines that says AI will solve everything, and there is also very doomsday scenarios that says AI will break everything, it will never work, it will always be bad, and I don't think that's also fair. I think that it's also lot of nuance on things that AI can do, and of course, on things that AI cannot do and won't be doing anytime soon. So I think that's important to keep in mind. the role here is not to be an expert, not to be a computer scientist of any sort. I think the role is to ask questions and ask those questions that nobody else is asking. So please be curious, be critical, and stay open for all what I think it's a really, really exciting moment for be in AI and for being research and be shaping this. Thank you very much.
Thank you. Thank you so much, David. There's been quite a lot of discussion and things that have come through in the, the questions. I wanted to just start off this discussion by asking a question that came through initially when we asked people to register. And this is to Diana and David. Given everything that's happened, do you feel optimistic about the future of artificial intelligence and the benefits it can potentially bring to healthcare and research? Just after this discussion and your own involvement, just curious to hear your thoughts on the potential of AI. Might start with Diana.
Thank you, Anthony. Flinging the hard one on. I think we have to be, as David said, curious and critical and keep working at it. It's here to stay, but what form it stays in will be something that we can be involved in to the max. Optimism, probably a bit strong for me at this stage. I believe it's got huge benefits to be provided, but I'm concerned about the impact on workforce, for instance, what it means for healthcare. Really concerned about the fact that I think the ethical issues and the data, the reliability and validity and who's running the show are still missing in a lot of areas. I see from where I sit involved in both research and in consumer activities within a health service that's very wide and distributed, there seems to be a bridge missing, and particularly with the university sector. What happens, what's normal to be doing for some researchers to be doing if they're employed by or part of a university research profile may be different from what is expected of clinicians who are embedded in a health service. And not forgetting primary care in GP land and where a lot of health work in the community. To me, there's an overarching mechanism missing. We need some sort of a framework, I think. So positive about it. We must stay involved. We must educate ourselves. But how we do that, I think, will be watch this space.
Thanks, Diana. And David, what are your views? How do you feel, optimistic or not, about the development of AI?
Yeah, well, I research AI, so I think I in a way I'm tending towards the optimism because I can see the huge potential of these tools, and I think the potential it can be in many different areas and in many different locations and places that traditionally haven't been receiving very good care, and I think it's there where the potential for improving is the biggest, I would say. Being optimistic also means it's not being naive or not trying to oversell things, because I think there is a lot of that in AI as well, and I think it tends to be more and more involved in a sort of what I would say is a sort of a cultural war. Is either you are for or against AI, and there is no sort of middle ground. And I don't think to me, that's not the correct framing. I think there is a lot of problems with AI, and Diana mentioned quite a few of those. And we don't need to overlook them. The risk of only focusing on those problems is that we will never see the benefit either, because I think there is a lot to gain and a lot that can be done better. And I think part of the issues is that we are trying in a way to use AI as a patch to the current system. The healthcare has many flaws, and we say, oh yeah, that doesn't work really well, so let's put AI there and it will be better, right? So I think that's probably not the best approach either. I think we need to think of how AI can do things better. This is what it currently works, and let's don't think, let's put a patch here. Let's think, okay, let's do better. Let's think of something that can really be an improvement from what we actually have. So in that sense, I'm optimistic. I think we need to be optimistic for this to be better. Yeah.
No, that's helpful. Thank you. And I think that advice about looking for the middle ground, and that we as consumer representatives and consumer advisors can play that role in a lot of projects about pointing out both the benefits and the concerns, I think is a really important role. And what we're hoping this webinar is sort of helping to contribute to. There's been quite a few questions coming through around governance of projects using AI and governance of AI in healthcare and medical research. And we've got a whole range of resources and links that we're going to share with people after the webinar. But I'm just wondering if there are particular areas of AI governance, particular resources that you think it's useful for consumers to be aware of when they're part of these conversations. David, I might start with you and then go to Diana.
Sure. Well, I think, first of all, I think the resources that you will be sharing are very important. I think having a look of those and having at the work that Commission, the universities, the healthcare sector has been doing, it's a good place to start. I think the issue is that in a way our governance structures are lagging a bit behind of what all of this is doing. So I think it's good to keep those in mind, and it's good to ask questions about governance when you are involved in these projects. And I think anything from privacy, data, ownership, who is responsible of this, who is accountable, and even more general, is there an AI governance contemplated in this AI project, or are just testing things out of the blue? So I think those questions are important, and I think we are as researchers, we are also still of waiting or having more clarity about the AI governance. And I think it's different unis and different research institutes are moving at different paces on this. So I think first of all, check the resources that we currently have, and ask for AI governance. Ask if there is an actual AI governance process in the project.
No, thanks, David. Good suggestions. And Diana, just your thoughts about useful AI governance resources or other resources that consumers should be aware of.
Okay. I liked there's a lot of work being done in different patches at Commonwealth, State, Institute and Alliance level. David, I'll let you talk about the Australian Alliance for AI that I think you're a founding member of, which has got a roadmap, which is fantastic. But I'm seeing really good consultation processes, talking at different Health Consumers New South Wales, Tara's communication strategies that you've set up for people to use. People at different associations like Australian Association of Gerontology are running forums and workshops But it's all happening. It's sort of dotted around. If I could just use my hands for a minute, there's all these things happening like stars in the sky. And where's the governing? How will we ever pull it all together? Is one of my questions. There's some really good work being done. The AQ Council on Healthcare Standards have produced a guide for clinical users. It's great work, but at the end of the day, there is no discrete policy that I'm aware of that says you must do this, you must declare that, these are the things you must do. NHMRC have put out a few guides. And one of the things I've become aware of since being involved as an investigator in research projects is that health research ethics committees are now apparently starting to produce guidelines independently from each other. So this is a recipe for disaster as far as I'm concerned. I think NHMRC are going to have to step into the gap at some point in the research place and say this is what the guideline will be for. I think David's PDBSH framework is fantastic and should be so. Don't try not to sell it, David, just make it available because it is really it is simple but complex at the same time framework that we should be promulgating to all consumers. But I've personally had different experiences from different research projects, which you sort of manage, but it's pretty alarming when the standards are different. You've got academics who there doesn't seem to be any strict policy guideline at a lot of institutions about which AI models or tools can be used. So people are just doing their own thing in the absence of a framework or a policy or a guideline. And then you've got healthcare services, and I think we're a little bit behind the 8 ball. I think Australia generally is a bit behind with AI development, but I think we've got to get a handle on who controls the policy issues around AI in healthcare and research.
No, thank you, Diana. I think you've raised a lot of really important issues there, and that the fact that across different, whether it's ethics committees, health services, in different areas, there's different frameworks being developed is something that is concerning. The framework that David has put together, we think is really useful, and what we'll be doing is with the framework and the questions that David's put together in his presentation, we'll be turning those into fact sheets that consumers and carer representatives can use in your work, when you're involved in health service and research projects. So thanks for that, David. We're looking forward to developing those fact sheets with you. We've had so many questions, and I'm just apologising in advance that we're not going to be able to get to everybody who's asked some questions. Some of our future planned webinars will touch on these questions, and I'll talk about those in just a minute. But before we go to that, and before we wrap up, I just wanted to ask both presenters about what's the next step. So we've got the information, we know about both the great potential and the risks that AI poses. We know about those issues that Diana raised about the whole different ways that different organisations are applying and using AI and the frameworks of governance. What's next, and what should we as consumers and consumer representatives be doing? David and then Diana.
I can go first.
Yes, please.
Yeah. So I think two things. I think it's first of all, it's I would ask to be involved as much as possible, and I think researchers such as myself, We are eager to talk to consumers. We want to know more. We want to have you next to us when we are sort of designing these AI tools and AI research projects. And I think that's, to me, that's what is more important. Is we can talk and collaborate. And I think we are in this moment of history and on the development of these technologies that we can really shape things, because maybe in 10 years' time is going to be late. I mean, not late, but probably somebody will have already done it in a way. So I think it's important that we engage and everybody engages now. So that's one thing, and I think all the or some of the questions that we are asking or that we want is more clarity from the government institution level. So I think, to me, that is also a role for consumers to play in terms of advocacy. We can do that as researchers, but I think it's even more important that doesn't come specifically from us, from researchers or academic, or not only from us, but also from consumers.
Great. Thanks, David. That's quite insightful. And Diana, your thoughts about next steps here?
Well, I would like to take a bit of a giant leap forward and say that I think the way that we're going to be most effective as consumer representatives is if we form very strong collaborations. And I'm talking across NGOs, across consumer groups, and there's a few we could start with. I mean, Health Consumers New South Wales and CHF, for instance, and other groups. But I think we should be looking at the possibility of applying for NHMRC funding for consumer-led research into the impact of AI on healthcare and research. It's time to put our money where our mouth is. NHMRC, then there's new ideas grants, which I think are like scarce as hen's teeth. But why not seize the day and try and do something really strong and positive? Worry about how we're going to do it, put something together, and start applying for funding for consumer-led research into AI and the use of it in healthcare and research.
That's super, Diana. And there are opportunities for consumer-led research that I know we perhaps haven't taken as much advantage of as we should. So that's some great ideas and a way to really push consumer leadership in that issue. So I'm very aware of time, and I just wanted to thank our presenters. Thank you, David and Diana, for your contributions today. And thank our friends at Sydney Health Partners as well for partnering with us on this webinar and this webinar series. As I've said to everybody, I'm really sorry that we haven't been able to get to all your questions today, but we are taking them all on board, and they will help inform some future webinars on the topic. I would just ask that, Tara, could you please start our second poll? Just asking about, after attending today, how people feel with the how comfortable people feel now about being involved in AI projects. Thank you. We can see that people still like it's interesting. It looks like a majority of people. Well, we haven't got, so yeah, about half people feel that they feel a bit more comfortable about being involved in projects. That's good to know, and we'll just keep that open so people can add how they feel about that, and particularly any suggestions for future webinars, not just about AI, but also other sort of webinar topics is always useful to know.
Anthony,
yes,
sorry,
Diana.
could I just suggest it might be useful for the folks that felt they hadn't felt more comfortable about it at the end of the seminar, would they be interested in putting to us the things that would make them feel more comfortable? Is there something we've missed out on? Would they like to suggest, understanding that consumers come from all walks of life and you don't have to be an expert or anything else, but if the ones who felt they hadn't got much out of it, could they give us some direction about what they would like?
That's a great idea. And we can ask people, they can pop that in where we've got future suggestions for future webinar topics. If people wanted to just put in there a bit of background about why or other information that people would use, we can do that. That'd be really helpful.
Mm-hmm.
So this is some of the links that we've already talked about. Don't worry about taking notes of them now. We'll provide people with a follow-up email and we'll put them on our website. There's some of the links to the governance and other studies that we talked about that people might find useful. In terms of future webinars in this series, the next joint webinar with Sydney Health Partners will be looking at the human factors in AI and healthcare with Professor Melissa Basari from the University of Sydney. That's going to be happening on the 21st of April. And we'll send out, we've got a link that people can register their interest for there. We're also in the process of putting 2 more webinars together. One's around the ethics of AI and healthcare, and the other one, which we're getting a lot of questions on, and we can see in the oh, sorry, I didn't mean to do that. In the questions is the use of AI scribes. So we'll be I'm sorry, we're just finalising a date now around the use of AI scribes and what that means and for people's care, because that's a question we're hearing a lot about. People can use this QR code. As I said, we'll also send out the link to register for the webinar on the 21st of April. And our friends at Sydney Health Partners also have a webinar around consumers in health research and what that means. So people who are perhaps not involved in health research at the moment but are interested in how they can contribute might be particularly interested in this webinar. And last but not least, we wanted to let people know about another webinar that Health Consumers New South Wales is putting on, not about AI in healthcare, but about older people's experiences of ageism in healthcare. And we'll be joined by Robert Fitzgerald AM, the Age Discrimination Commissioner, talking about the recent report that the Australian Human Rights Commission has put out about older people's experiences in healthcare. So we're fast approaching time. So I again want to thank all our participants today. Thank you, Diana. Thank you, David, for your time and your insights. I also want to thank Tara, the wonderful Tara Lee, who's been driving things behind the scenes, and it wouldn't have happened without Tara's technical support. So thank you all very much. Thanks all of you for participating today, to take an hour out of your time to be part of these conversations. We really appreciate that, and we really appreciate your input and the questions. Those questions, even the ones we didn't get to, are really important and will help us with designing our next lot of webinars and information out to everybody. So thank you all very much. We really appreciate your time. And we'll catch you all at our next webinar, hopefully see you all on the 17th of April. Thank you all so much. Bye.